Every 3 seconds, somewhere in the world, a new case of dementia is diagnosed. By the time you finish watching this video, dozens of families will hear words they hoped they would never hear. And here's the part that makes this topic so frightening. Most people don't wake up one morning unable to recognize their family. Memory problems rarely begin that way. They usually start with something so small that almost everyone ignores it. You walk into the kitchen and suddenly forget why you went there. You misplace your glasses. You forget an actor's name. You stand in the grocery store trying to remember what you came to buy. You laugh. You blame aging. You move on. And most of the time, that's exactly what you should do. Because not every memory slip is a warning sign. In fact, many people spend years worrying about dementia when their brain is actually functioning normally. The real problem is the opposite. Some people ignore the warning signs that actually matter. Today, we're going to draw a very clear line between normal aging and the kinds of memory changes that deserve attention. We're also going to talk about several hidden conditions that can look exactly like dementia, but are often reversible. And near the end of this video, I'll show you the one lifestyle habit that has repeatedly been shown to help preserve the part of your brain responsible for memory itself. Let's start with something most people never hear. Why forgetfulness is often predictable. People often talk about dementia as if it strikes out of nowhere. That's not usually what happens. For most people, changes begin years before a diagnosis is ever made. The brain doesn't suddenly stop working. Small systems start struggling. Communication between brain cells becomes less efficient. Certain proteins begin accumulating. Blood flow may gradually decline. Sleep quality often worsens. And eventually the symptoms become noticeable. But here's what most people don't understand. Not all memory problems are caused by damage to the brain. Sometimes the brain is simply missing something it needs. Other times it's fighting a problem that nobody has identified yet. That's why the first question should never be, do I have dementia? The first question should be, what's causing this memory problem? Because the answer isn't always what people think. Normal forgetfulness versus dangerous forgetfulness. Let's start with the memory slips that are usually normal. You forget where you left your keys. You struggle to remember someone's name. You walk into a room and lose your train of thought. A few minutes later, it comes back. That's not unusual. Your brain contains roughly 86 billion neurons and trillions of connections. Sometimes a signal simply gets delayed. Think of it like traffic on a busy highway. The destination still exists. The information just takes a little longer to arrive. Now compare that to something different. You forget where you parked your car. That happens. But forgetting that you drove there at all? That's different. Forgetting a word is common. Asking the same question 5 times in 20 minutes without remembering you already asked it is not. Being briefly confused about today's date after a poor night's sleep is understandable. Getting lost driving to a place you visited every week for 15 years deserves attention. Here's a simple test. When you forget something, do you know that you forgot? Most healthy people become frustrated when they misplace something. That frustration is actually a good sign. Your memory system recognizes the error. What becomes concerning is when the entire event disappears. No frustration, no awareness, no memory that the mistake even happened. That's a different pattern, and it's one worth discussing with your doctor. But before anyone jumps to conclusions, let's talk about the hidden conditions that often imitate dementia. Hidden cause number 1, vitamin B12. Deficiency. The first surprise is vitamin B12. This vitamin plays a critical role in nerve function and brain health. Without enough of it, people can develop brain fog, poor concentration, fatigue, numbness, and memory problems. And here's the catch. Many older adults don't realize they're becoming deficient. As we age, the stomach often produces less acid. That matters because stomach acid is required to separate B12 from foods like meat, eggs, and dairy. Even if you're eating well, your body may not be absorbing enough. Research has shown that reduced stomach acid becomes increasingly common after age 60. Another factor is medication. Millions of adults take metformin for blood sugar control. While effective, metformin can interfere with B12 absorption over time. The result? Memory issues that sometimes look alarmingly similar to early dementia, yet the solution may be as simple as a blood test and appropriate supplementation. Not every memory problem requires a neurologist. Sometimes it requires identifying a deficiency. Hidden cause number 2, the infection that can mimic dementia. Overnight, This next one surprises families all the time. A urinary tract infection. Most people associate UTIs with burning, discomfort, or frequent urination. Older adults often present very differently. Sometimes the first symptom appears in the brain: confusion, disorientation, agitation, sudden personality changes. Doctors call this delirium. Families often think their loved one has developed dementia overnight, but dementia doesn't usually work that way. Dementia tends to develop gradually: weeks, months, years. A sudden dramatic change over 1 or 2 days often points somewhere else. And infections are one of the first things doctors look for. The encouraging news is that infections are often treatable, which is exactly why recognizing the difference matters. Hidden cause number 3, your thyroid. Another overlooked cause sits in the front of your neck, your thyroid gland. Think of the thyroid as your body's metabolic thermostat. When it slows down, many systems slow down with it. Energy drops, mood declines, thinking becomes sluggish, words become harder to find. People often describe feeling like they're moving through mental fog. Once again, this can resemble early memory decline. Fortunately, thyroid function is easy to evaluate through standard blood testing, and if an issue is found, treatment is often straightforward. The medication trap nobody talks about. Now let's discuss something sitting in many medicine cabinets: diphenhydramine. It's the active ingredient in Benadryl and many over-the-counter sleep aids. People take it because it helps them sleep. The problem is that it blocks a brain chemical called acetylcholine. Acetylcholine is heavily involved in memory formation. In fact, many dementia treatments are designed to help preserve acetylcholine activity. Long-term exposure creates concern. Research following thousands of older adults found that heavy long-term use was associated with a substantially higher risk of dementia. This doesn't mean the occasional allergy pill is dangerous, but if you've been taking a nighttime sleep aid every night for years because it seemed harmless, that's a conversation worth having with your doctor, especially because safer alternatives may exist. The brain's night shift. Now we come to one of the most fascinating discoveries in neuroscience. Your brain has a cleaning crew, and it mostly works while you're asleep. Scientists call it the glymphatic system. Think of it as a pressure washing system for the brain. During deep sleep, fluid moves through brain tissue and helps remove waste products. Among those waste products is beta amyloid. This is one of the proteins found in Alzheimer's plaques. When sleep is consistently disrupted, cleanup becomes less efficient, and the waste begins accumulating. Researchers have found that even a single night of severe sleep deprivation can increase markers associated with amyloid buildup. One night. Imagine what years of poor sleep might do. This is one reason sleep specialists increasingly view sleep disorders as brain health issues, especially sleep apnea. If you snore heavily, wake up gasping, or repeatedly stop breathing during sleep, your brain's nightly maintenance program keeps getting interrupted, over and over again. The 2 biggest memory myths. Let's clear up 2 myths. Myth number 1. Statins destroy memory. Years ago, reports raised concerns. Since then, researchers have examined data involving millions of patients. The strongest studies consistently fail to show meaningful memory damage. Some large analyses have actually found lower dementia risk among statin users. If you're concerned about your medication, discuss it with your doctor, but don't stop treatment based solely on internet rumors. Now, myth number 2. There is one perfect brain diet. People love simple answers. Eat this berry, avoid that food, follow this secret plan. Reality is less exciting. Healthy diets matter, weight management matters, blood sugar control matters. But no magical combination of foods has proven capable of overcoming poor lifestyle habits. Consistency beats perfection, every time. In 2024, researchers from the prestigious Lancet Commission updated one of the most important dementia reports in the world. Their conclusions surprised many people. They identified 14 modifiable risk factors, and addressing them could potentially prevent or delay nearly 45% of dementia cases worldwide. Not cure, prevent or delay. That's still remarkable. One factor stood out: hearing loss. Many people think hearing loss only affects the ears. The brain disagrees. When hearing declines, the brain must work harder to decode speech. That extra effort leaves fewer resources available for other tasks, memory included. There's another problem. People with hearing loss often withdraw socially. Fewer conversations, fewer activities, less mental stimulation, more isolation. and isolation itself is associated with cognitive decline. One major study found that hearing aids significantly slowed cognitive decline among higher-risk older adults. The lesson? Protecting your brain sometimes starts with protecting your hearing. Now for the habit with some of the strongest evidence in brain health. Walking, not supplements, not miracle pills. Walking. Researchers followed older adults who gradually built up to 40 minutes of brisk walking 3 times per week. Another group performed only stretching exercises. After 1 year, something remarkable happened. The walkers showed growth in the hippocampus. That's the memory center of the brain. The stretching group did not. Why? Because exercise increases production of a molecule called BDNF. Think of BDNF as fertilizer for brain cells. It supports learning, memory, adaptation, growth. And one of the most reliable ways to increase it is movement. No prescription required. The 5 warning signs you shouldn't ignore. So when should you actually worry? Watch for patterns, not isolated incidents. 5 warning signs deserve attention. Repeatedly asking the same questions without remembering you already asked them. Getting lost in familiar places. Difficulty following familiar tasks, recipes, or routines. Pulling away from hobbies, social activities, and relationships because keeping up feels overwhelming. Poor judgment involving money, safety, or everyday decisions that used to be easy. One occurrence doesn't automatically mean dementia. A consistent pattern developing over weeks or months deserves evaluation. Here's the truth. Growing older does not mean you're guaranteed to lose your memory. Many causes of forgetfulness are treatable. Some are reversible. Others can be slowed dramatically when identified early. The goal is not to panic every time you forget a name. The goal is to recognize the difference between normal aging and warning signs that deserve attention. If you've noticed any of the patterns we discussed today, write them down. Bring them to your doctor. Specific examples are often more useful than vague concerns. And remember this, aging is inevitable. Losing your curiosity isn't. Losing your willingness to learn isn't. And in many cases, losing your memory isn't inevitable either. If you found this helpful, subscribe to Vital Years. We have many more evidence-based videos coming that explain health, aging, and longevity in plain language without the fear, hype, or nonsense. And I'd like to hear from you. Have you ever experienced a memory lapse that made you wonder whether it was normal aging or something more serious? Let me know in the comments below.